media conversation, North and South, and what opinion leaders think and feel. And in the past, this one's really important. It used to be, say, a nurse from the UK might be a more compelling spokesperson within the UK than a nurse from Ghana or a health worker. That's shifted, and now it's kind of neck and neck with voices from the global South being viewed as more credible messengers. And then how do we meet people where they are? The implications that we've landed on from this is acknowledging the current environment is important. We can't pretend like things are the same as they used to be. Health is an effective entry point for broader development. So there was low confidence in ODA, high confidence in global health institutions. Innovation in child health reflected the most energy and promise in the continued investment in health as themes. And then there were four messages that performed particularly well. So I'm going to go through. Again, the global mood is shared negativity and pessimism, which makes communications challenging. So the question being, all things considered, over the last 20 years, do you think the world has gotten better, worse, or stayed the same? And so this is a broad question. And if you look at countries in the global South, 43% have felt it got better, 51% felt it got worse. There's a big disconnect between how people perceive progress generally in the North and South. And in the North, 74% felt like the world has gotten worse. When asked if they feel like the world will get better or stay about the same, there's a lot more optimism from countries in the global South than there are from countries in the global North. And I'll talk about it a bit later, but when you compare that with the increased trust and confidence in messengers from the global South, you've got a greater level of confidence about the future and more trusted messengers, which tells us something about how we are developing our communications, who we're featuring, and how we're elevating voices. The question here being, all things considered, over the last 20 years, do you think that the world has gotten better, worse, or stayed the same? This is really looking at the country level. It was most acute in the UK and Germany, with very big drops in where they felt the world has moved. And then if the world get better or stay the same, again, the net drop in the UK and in France, significant. So global concerns. What do people care about? If we ask them generally what you care about, it's the economy. It's basically climate conflict and the economy, right? North and South. You see across those countries surveyed in the global South, it's unemployment, taxes, inflation, etc. Healthcare, number 6, number 7, number 4. So it's not at the top of the list. And what do you think are the most important issues facing the country at this time? Again, I just went through this, but we see where the global South countries feel healthcare lands in relation to other issues. Social media reinforces this. You've got war and security, the economy, employment, immigration, climate, health, down lower to the middle. So it tracks both from a political opinion standpoint and a social media standpoint. When asking about ODA support, it's pretty much at an all-time low. How strongly do you support or oppose overseas aid to developing countries? So you see the 5 donor governments that were surveyed. And the decline in ODA correlates with a mood of greater negativity and pessimism. So past research has shown us that a belief that progress has been achieved leads to a belief that progress is possible in the future, which leads to greater support for our issues such as ODA. So the increased negativity about past progress and the pessimism about the future leads to a logical support, a decline in support for ODA. ODA supporters in donor countries tend to be, and this should not be a surprise, higher educated, higher income, and opinion leaders. And the question being, how strongly do you support or oppose? So if you look down the right, you see exactly how that lands. The longstanding left-right divide on ODA remains evident. If you look at right wing, center, and left wing, there's more support for ODA on the left than there is on the right. And then talking about the global health context. Global health news accounts for 0.7% of all news, and it's mainly around risk framing, right? So it's generally negative coverage. And you see where the coverage goes from a news media analysis standpoint. It's really focused on economy, climate change, and conflict. News media analysis shows the focus of Global South news differs from Global North news. And you see in the North, it's more COVID. In the South, it's more HIV, kind of malaria, infectious diseases. This I just went through, so I won't spend a lot of time on that and that. On the social media side, it's vaccines and COVID that are most prominent in digital conversations, and there tends to be a lot of disinformation. And what we saw during COVID from information disinformation standpoint is when there were, it's a volume game, there were a lot of voices in the conversation, an equal number of supportive and detractors, and now the supportive voices have dwindled and the detractor voices have stayed the same. Views of global health. Top of mind associations North and South when asked about global health. And the term global health doesn't tend to be a very effective term. People don't know what it means or how to translate it. So when you looked at it across North and South, you had that Venn diagram in the center of COVID, cancer, and mental health. In the North, it's more communicable diseases. In the South, it's more infectious diseases. In the digital sphere, it's a bit broader. And this is an interesting one. The shift in top of mind associations meant donor countries required more prompting to shift the lens on global health issues. And so when COVID was prominent, unequal access, the inequities that people saw really led to a conversation and a lot more knowledge. Unfortunately, we're back to where we were with those conversations not happening and people's knowledge of the impact of unequal access to health dwindling. Again, we talked about this a bit. It remains an ineffective term more broadly. So the question being, thinking specifically about health around the world over the last 20 years, do you think that health at a global level has gotten better or worse or stayed the same? And do you think, and this is both from a global South and a donor country. So health and then the world. And you see again, in global South, there's much more positivity in perception. And thinking specifically, again, about progress over the next 20 years, there's a lot more optimism in countries in the global South in what could improve both generally in the world and specific to health than there are in donor countries. And this is also an interesting one. So how much more optimistic or pessimistic do each of these make you feel about the world's ability to tackle health issues in developing countries? So when we're looking for an entry point to inspire confidence and more hope, technology, AI tend to be the strongest. People working together, Climate change is not there yet, as you'll see. And surprisingly, the global response to COVID is in the global south viewed more positively probably than it should be. So people in donor countries see health as the most important issue to address in developing countries, but knowledge of their own country's contributions is low. So people in the North feel like investments in health in the South are important. They don't really know what that looks like from their own country standpoint. And this is a really interesting frame to think through in how we position global health. And it used to be that moments for leaders to stand up behind a podium and show their leadership was an important component of communications efforts. And now people really feel like they should be doing their fair share, not taking a lead. So when you play that out, what does a fair share approach to global health investment look like versus a leadership approach? And you see this with struggles, I think, to land host countries for a lot of resource mobilization efforts currently. Support for funding for international health organizations remains high, well ahead of support for ODA generally. And I think that's because we can point to tangible health impact that's happened as a result, and ODA tends to feel a bit more esoteric. Attributes of those who support funding for international health organizations, Gavi, Global Fund, WHO, et cetera, are broadly aligned with ODA supporters. Who are the people that support international health organizations, but not ODA? It's about 17% of the public across donor countries, according to our research. They're likely centrists. They're more likely to be negative and pessimistic about progress. And their views largely align with the typical respondent. And they're more likely to say that health is an important area to support in low and middle income countries. So the question being, how well do you think the healthcare system is working in your country? And so across the global South, there's overwhelming feeling that it's not working that well, which I think is another unfortunate helpful argument for international health organizations, institutions like Gavi, like Global Fund, et cetera. People in the global South see their national governments as the most responsible for improving health. It's not that they necessarily feel like they're doing it, but they feel like their governments should be the most responsible. When you think about the path to independence, that's meaningful, I think, a lot in the US Congress and others. This is a strong message to carry through, that this is a shared feeling, North and South. But there are lots of things that are standing in the way of seeing this actually happen. Health is rated as one of the top issues in which donor support is needed, only behind economic growth. So countries in the global South were asked, where is external support most needed? Economic growth first, health second. So again, the case can be made from global South voices who are naturally more optimistic and tend to be received more credibly. Most believe that their countries need outside help on these global health challenges. You see that below. Those who think their country needs external help cited a variety of reasons of why this is necessary: a lack of confidence in national governments to address their own health issues, a perceived lack or slow pace of current progress in addressing those issues, and the positive impact of past external support. Social media analysis shows online conversations in the South support foreign aid and investment for development, including R&D and local manufacturing. Decision makers in the South celebrate partnerships with donor countries on social media broadly. In donor countries, no consensus on which health issues should be the priority to address, but support for consulting local leaders. So this is really adding up to the move, which is long overdue, for more countries setting the agenda more broadly, and for the voices being elevated in a much more meaningful way. Global South countries are more positive on the progress made to date on specific issues than our donor countries. So when you look at donor versus Global South on child health, there's a much stronger sense of progress. The same on infectious disease. Nutrition wanes some. Vaccines, you see, it's relatively close. And family planning, there tends to be, I think, lower confidence across the board, not just in this single slide, but in a lot of the testing that we do. The strongest sense of progress is around tackling infectious diseases. So when we're case making, there's a good use for the progress that's been made. And a lot of people coming in and out of the political system may be kind of new to understanding their country's investment in global health. So there's a back to basics approach that has been broadly discussed to remind people what's happened in the past and the impact that has made. And then the messengers, we talked a bit about this in previous research. It showed that messengers from the global north were more convincing. And so this is what was shared this time. So a nurse from Ireland, let's say, speaking to opinion leaders in the UK versus a nurse from Ghana. And the same with a prime minister or a minister of health. And we see across the board, with one minor exception, the progress made in seeing Global South voices as equal, if not more compelling, and particularly at the ministerial level. We're going to, in the next round of testing, we're going to test this, I think, much more deeply and look at who's more convincing, ministerial level, health worker level, how are people depicted and perceived, and what is the impact of that type of depiction? And then messaging, we tested 14 messages, and I've highlighted the ones that tended to work the best. Global health security, which is a longstanding message, certainly in the US, but in other countries, continues to test well, although it's taken a bit of a hit. The economic self-sufficiency message is a message we hadn't really tested that much before. And it's basically healthy adults can contribute to the economy, lead productive working lives. I can put food on the table, I can put my kids in school. That message tended to perform the strongest north, south, right, left, and center, which is interesting. And then we tested something as health is a sure thing. So if the crisis of the moment is anxiety and uncertainty, health is something that's generally measurable, where we've had past progress, and people might want to hold on to something concrete in a moment where they don't feel like they have much to hold on to. And then health equity also has performed well. So this is what it looks like in donor all in the South. Again, interestingly, the economic self-sufficiency message performed the most strong, followed by global health security, and then followed by equity. You go down there, health as a unifier did quite well. And there's, a few of them as well that seem to stand out. This is what it looked like from a country perspective. And it makes sense if you think about the biggest concerns being the economy and inflation, the economic argument resonating most strongly. When you look at ODA supporters and opponents, again, that economic self-sufficiency message performed the strongest. Again, across the political spectrum, right, left, and center. We tested a moral argument, like, is humanity on trial for failing people? And it's, it tested well in certainly on the left. So I think the advice would be to use it sparingly or thoughtfully. We talked about this. This is just a deeper dive into how these individual messages that were the top ones landed. And all of this is available on the website. the same messages resonated most among opinion leaders. So basically, these are the things that worked. Some other ones worked as well. The solidarity and collaboration, climate change is beginning to gain ground as well. And then that health is a sure thing in a time of uncertainty. Older respondents tend to find messaging more convincing, probably also not a surprise. And then I'm going to end with this slide. So pre and post testing shows a 15% increase in net supportive funding for international health organizations after being exposed to these messages. So when asked again after being exposed to the messages, their support increased 15%. So I will stop there and take time for questions. And again, this was one round of research with about 7 countries. Another 8 countries are up next, and it will be combined. On the website, you'll find this research. You'll also find some assets in the future. We're working with DevEx to do an explainer series on how these global health institutions work together. A lot of questions that advocates were getting were, what are all these things? Why am I funding them all? How do they work together? So there'll be an explainer that will allow people to say, actually, it's not crowded and competitive, it's more comprehensive and complementary. And let me explain how. So I'll stop there and take questions.
Thanks, Marshall. That was really great, even though I just learned that our name, Global Health Council, is a completely ineffective message.
Not for your
not for our audience, but yeah. So if anyone has a question, please put up your hand. I did want to ask you, maybe as a kickoff, about the fair share argument. I mean, I think we've tried that in past times, past iterations, and it can go either way on the fair share. I mean, you can make a kind of monetary calculation based on data presented by the UN or whatever, and then the fair share is quite large for a country like the United States. But you can also have a less progressive argument under fair share. And for me, that piece ties to something that we've been getting, I think, as a community, questions about now more than ever, which is, what's the off-ramp? Like, what's our fair share to stop having to pay? And I don't know if you have any insight into that from your research, or if that's sort of teeing up another messaging exercise coming up. So maybe you can answer that one, and then I see people are starting to raise their hands. So then we'll take the first round after this answer.
Yeah, and there's always a distinction between a communications approach and actually what's happening, right? And so the fair share conversation holds water if you are doing your fair share and not more than your fair share. But I think it was more about the sentiment of people don't want to feel like their government is doing more than is necessary or more than other governments. And so it's more a positioning frame. On what's the exit strategy for this, it's interesting. I mean, one of the things that we're going to try to test, if we can figure out how to do it, is if you think about debt in the global country debt in the global South, and the money that's left for health programming, there's very little. And so when countries are burdened with debt and there's not debt relief, then it makes it nearly impossible for the exit strategy to take effect. Is that a helpful argument to donor governments to say, countries want this? We've got the research that says everyone feels like their government should be responsible for this. But structurally, it's just not possible where we are right now. And does it become a two-pronged conversation between debt and aid? So I think that's something that we're looking at trying to test. And I see some questions, but I don't have numbers next to them. So if you weren't first and I call on you, I'm sorry. Mandy?
It's okay. I'll help you through this.
Okay, good. Okay,
yeah. Good. And when you come off mute, whoever you are, if you just introduce yourself, name, title, organization, so Marshall knows who he's talking to. And I actually see Eliana first. Do you want to take a few questions at a time, Marshall, or you want to go one by one?
Sure.
Two at a time. Okay, so we've got 3 hands. So Eliana, you're up first.
Thank you. This was a great presentation. I had a quick question about some limitations to the research and what those might be.
Eliana, can you
introduce yourself? Yeah, my name is Eliana Monteforte. I'm the Director for Special Projects at Global Health Council. I missed the first few minutes, so I'm sorry if you mentioned this, but I wasn't sure how many countries were included in the research. I just pulled up your report and I saw a few global North, global South. I didn't see any middle income countries or anything from the Latin American and Caribbean region. And so I was wondering if you could speak to some of the limitations to the research. I mean, we know that we don't always have money to like capture everything, right? But how those limitations might impact the results if you see, I mean, it's hard to tell, but in your opinion, if you think that would really change the results that we're seeing now. Over.
Thanks. And we'll go to Rachel and then Mandy.
Yes, thank you, Marshall. This was a tremendous presentation. I'm Rachel Wistuff. I'm Director of Global Policy at UNICEF USA. We're the independent NGO that supports the work of UNICEF. And I'm going to sneak in two questions. The first is on the general support for international health organizations over like ODA more broadly. You mentioned WHO. I was wondering around the US specifically, how the US felt about WHO in comparison to some other high donor countries. And then my second question is, you spoke about how there's more positive perception of improvements that have been made around infectious disease, for example, less so on family planning. Based on that, like, does your research lead us to believe that we should be leaning in on the issues that are perceived as having had less success and kind of in need of more progress? Or is it better to like double down on the things that people are perceiving as positive successes to kind of carry forward the message? So thank you.
Thanks, Rachel. Mandy.
Hi, my name is Mandy Slutsker. I'm with the American Academy of Pediatrics. It's interesting, some of these messages that worked well are ones that we hear constantly on the Hill, specifically around self-sufficiency. My question for you is, were these messages on self-sufficiency framed for like a country level, like a country's graduation or ability to take on programs that were funded by donor governments and then they would be funded domestically? Or was it more of an individual level? Like if an individual is, has good health and, not getting sick with malaria and HIV and other things, then they're able to be more productive and participate in the economy.
Thanks. Over to you, Marshall.
Great. I'm going to answer those in reverse. So Mandy, yes, it was at the individual level. And so I think what we had tested in the past was the macroeconomic argument, but not really pushed on the microeconomic, meaning what does it mean for a family? And so even at the foundation, what I've been thinking through is, would it make sense for us to create a series of conversations that look at the economic impact of health at the family level, with leadership talking to people in communities about how their lives are better as a result to access to health. What are they able to do? And so just finding a way to, and this gets at all three questions. I think there's no silver bullet for the research, but it should be audience specific and country specific. And so countries will, the US, certain things are going to resonate very differently than in France or in Germany. And so hopefully people will be able to take this based on the implications per country and the downloads there and craft things that work from that perspective. The question on lean in on the negative or the positive, if you look at progress on infectious disease versus family planning, the lens through which this research was done was what's the best case making to continue to inspire confidence in investing in health broadly. And so the other thing that we heard, and we had a series of meetings with advocates that said, a lot of people are new to their political positions and don't even know what the Global Fund or Gavi is, for example, or what our contribution has been or the impact that's been made. And so I think, to me, the answer is you've got to remind people of progress that's happened, that it's possible, and then bring them into the potential for things to get better in other areas. And so that's the way at least we were looking at it. Regarding the limitations of the research in the country list, this was an expensive endeavor for the foundation. at a 14 country list. So we're doing it in 2 stages. First is the seven countries. I think it was 4 in the north, 3 in the south. The next will be maybe 5 in the south, 2 in the north. We picked those countries really as the foundation was most concerned about resource mobilization for Gavi and Global Fund moving into next year. And we asked what the priority countries were from a donor perspective and what were the most influential countries in the low and middle income country list that would match make. So what leadership from the Global South is most influential to what leadership in the Global North? And we use that country list. There are limitations. It doesn't include Central America. It doesn't include extensively Southeast Asia. I mean, India and Indonesia will be in there, but not beyond that. We did find a lot of commonalities between what existed in other research, and there was, before the research was conducted, there was desk research done on what else existed and what could be gleaned from that. And so there are some generalities that tend to be pretty true. But that was the lens through which we looked at this project and what we felt like we could fund. And again, this was a first time effort for the foundation to combine countries north and south, opinion leader, media, and digital to see if it could tell us something different.
Thanks, Marshall. If other people have questions, please raise your hand. I did want to ask you, Marshall, if just thinking about Mindy's question and your response that it was actually about individual ability, did you all disaggregate the data at all by gender or age? It seems like you did a little age maybe, but gender, no. I'm just curious because I think particularly that list of what's important for individual countries, we often see women answer health higher than men. And so just thinking about the audience and the storytelling a little bit of kind of what does that look like, or are there plans to disaggregate further?
That's a great question. And that came up in some additional feedback. We did look at roughly the age of people supporting ODA and international health organizations. We didn't disaggregate by gender. Where we did look at gender was health issues affecting women and children. And that tended to, as everyone knows, it resonates well, and then the funding doesn't really follow suit. So there's that conundrum. But I think the challenge we had was, given the number of attitude towards WHO, thank you for that. The amount of things we wanted to test with, I think the focus groups were already 2 hours or 2.5 hours long. So we had to limit some of that. I would pull down the research in the US deck on there. I don't think we went specifically into organizations. What we did do is ask name recognition, some name recognition. Generally in countries in the global north, in broader research, nobody knows who Gavi or the Global Fund is. They'll know who WHO, UNICEF, et cetera is. In the global south, Gavi and Global Fund have higher recognition than do than they do in the north.
Okay. I see 2 hands, Marissa and Bay. Marissa, why don't you go ahead?
Sure. I had 2 questions. I was hoping you could explain more the anger frame. I just didn't capture that when you were going through, and that showed up as sort of highly effective, or at least among the top in the global north. And yeah, just more curious about this like high support seen in the global north for international health organizations. And you spoke to it a little bit just now, but do we know what that means to people in the global north? Because I was surprised when I think international health organizations, I of course think these like multilateral bodies, and I was surprised to see such high support in the US for that. And I'm wondering if yeah, Americans perceive that as like international NGOs, if there was like a common understanding of what those terms meant. So just if there's deeper information to be shared there, interested in that. And then finally, just a last comment. If you do a deeper dive on trusted messengers, as you mentioned, you might do, I would welcome if there was an opportunity to look at researchers and scientists and whether there's a difference of opinion between stakeholders in the global north and south as to how trusted those messengers are.
Thanks, Marissa. And I'm not sure if it's B or Bea, so you're next.
It's B.
It's
I think that's okay. It's my question is a bit of a compliment. I'm quite interested in the connection between attitudes and funding, right? Because that's where the rubber hits the road. And I think having worked on family planning, you can say that family planning methods will increase women's economic productivity. And I could say that all day for many days. And I don't think in the end that that's the thing that necessarily translates into support that leads to funding, if funding is the metric. So I just wanted to reflect on some of the other or if you would reflect on what you think are other factors outside of just the characteristics of the messaging that are actually that are relevant for organizations trying to advocate still for funding for particular issues beyond just sort of return on investment, which I think we see, but just feel as though that argument gets you only so far.
Yes. So I'll answer these in reverse again. I mean, it's one thing I think, just having spent a long time in global health, in advocacy and communications, we're really good at informing and not so great at motivating, right? And so I think we can take a page from corporate brands on how they get people to care about products. And it's generally a more emotional frame than it is just a purely data-driven logical frame, although those are important when you get to the decision maker standpoint where they've got to decide on this funding versus that. But I think we can do a better job on motivating. The foundation did, before I joined the foundation, I was a consultant and led a project on reframing women's health and what that could look like. And we did a lot of additional research and testing, and initially a frame that I thought would be helpful, and I think it is, but it landed somewhere different, was something we were calling powered by women. So stronger communities, stronger families, a lot of this is powered by women, and how do women get powered, their health, access to health, et cetera. But what it turned into is a shift from women's health. And when I would say women's health to this group, people would generally think below the belt first, right? That's just where your head goes, versus healthy women. And when you think of healthy women versus women's health, you think broader and more external, and it opens up different conversations. And so I think one of the things we're trying to do with this project internally that I'm trying to do is to meet people where they are. And if they care about economy or they care about something else, how do we meet them there and then bring them where we want to go? And so I think that's the interpretation of the research now matters from an execution of communications standpoint and what we do with it. And so I think a healthy women frame is an interesting one, and has much more expansive opportunities to have conversations and to bring in issue adjacent champions than just the traditional champions. So those are some of the things that outside of this specific project we've been thinking through. The anchor frame was really something that we were initially testing, like, would that be a good voice for Bill or somebody like Bill to say, listen, humanity's on trial in this moment and we're not doing enough, right? And figuring out if that worked well with people and if it resonated. And it resonated with people on the left, less so in the center, and not much on the right. And so this might be a good tactic to motivate the base if the base needs motivation, but it might not be the right tactic more broadly. And the other thing that I was trying to think through in this, if you think about influence and you've got kind of a diplomat level, you've got an advocate level, and you've got an activist level. And if you think about common frames that people understand, you've got Bono at the diplomat level, you've got kind of organizations at the advocate level, you know, from gay rights to HRC, and then you might have ACT UP at the activist level. And when we look at the ecosystem of influence, are we funding diplomats, advocates, and activists to do their part at the right moments? Each of those different layers of the ladder are super critical from an influence perspective. And some are meant to have pitchforks, and some are meant to, you know, have a velvet hammer. And so when we're thinking about it broadly, are we aligning our communities effectively in those areas? And so it's, again, not to say the anger argument isn't an effective one, but it's an effective one probably for a specific group, for a specific audience. And then how do you pair that with something different? And then the high support for global health, I think it matters on the impact statements that accompany it. And so if you look at Gavi helping reduce child deaths by half over its history, or Global Fund supporting, you know, 59 million lives being saved, those statistics start to matter, and you can point to that. If you say ODA, it's such a broad construct, it's hard to put something tangible behind it that's immediately meaningful for somebody, that brings them closer to support. So I think those multilateral health institutions, organizations have an easier time because they've got more concrete arguments, which again doesn't necessarily help with the horizontal when we want to increasingly talk more about stronger health systems, but they do have strength on the vertical side.
Can I pick up on the messenger piece? And I see Rachel put this in the chat too. Just thinking about who is a preferred messenger, and in one of the answers you just gave, you used the word champions, which is a very popular word at your foundation and something that is often asked of all of us, to cultivate champions. Thinking about those champions tied to this messenger question, as well as, you know, seeing the top messages around self-sufficiency and economic improvement. Can you just dive into that a little bit more, of like how those things go together? Because I think we often, as a community, work to cultivate messengers around the morality argument, to be honest. And we don't have tons of messengers on the economic empowerment side, or champions.
Yep, and you know, I think it's, where could we show up at economic summits and talk about the impact of health? I mean, I think part of it is that, how do we engage economists more on the impact that health might have? How do we engage moms in talking about what they're able to do when they're healthy versus not? I mean, I think part of it is campaign type approach, like what would it look like to shift that entry point into the conversation and start with it from a different place? So it certainly could be that. You know, I think decision makers are deaf in their ears from the same people chirping in them on a regular basis. And it's not that those same people shouldn't still be engaged, but usually when you bring in a less expected voice, it's heard differently. And so that's something that we're trying to think about. One of the things the foundation is testing out for next year is kind of a global science fair. So if we feel like innovation increases people's confidence in investing in health, what would it look like to have a big show and tell? Here are some things that are in the pipeline that could be transformative to people in the future. So you get a sense of seeing it, and you get the feeling of inspiration, and you talk to someone, a scientist who might have developed it, in conversation for the first time with a health worker who's going to deliver it, and they've never met each other, and like, what could that look like? And then what might it mean to a family from an economic standpoint? So, I mean, I think there are different ways to go about it. That's probably a rambling, not satisfactory answer.
No, it's fine. I mean, I think we're we're all just looking for really good ideas right now because we recognize the opening slide that you started with of kind of like pessimism and negativity. So I know we have just a few minutes left. I want to make sure if there's any other questions, people get a chance to ask them. And I'd also just love if, Marshall, you could share a little bit about who you are sharing this with. I mean, obviously Global Fund Gavi, have you shared it with USAID's Global Health Bureau, State Department, anyone in Congress? What would you like to see as its extent of dissemination, you know?
Sure. I mean, we consider this a public good. And again, it's half the research. And so we've done a bit of a soft promotion of it. But having said that, I think I put something out on kind of my LinkedIn. We've done a couple of emails and I've talked to a handful of groups about this. And I think there were like 2,000 unique visits to the site and maybe 300 downloads. And one of the researchers shared with me, like the average download from the World Bank on a research paper is 1.5 downloads. And if you count the author, that's one of those. And so what we've tried to do is make it as usable and directive as possible. Any feedback would be appreciated. We haven't really started the broad promotion of it, so you are free to share that with anyone you would like to.
Okay, got it. Let me make sure we get Rachel and Marissa's two last questions before we sign off. So if you could be brief, because we don't have that much time. Go ahead, Rachel.
Yeah, Marshall, just on the methodology, I'd popped open the US specific one. So I take it to mean the focus groups were in just DC, but then the general online perception survey was much broader, like rural and urban.
Mm-hmm.
Okay.
Well, that was an easy one. Yeah, Marissa.
Yeah, I mostly just wanted to thank you for being so public and sharing this. I've been in the sector for 10 years, and there's been many a Gates Foundation funded research shared with me in behind the scenes meetings that I've done screenshots for and tried to save for myself to apply in our own work while it's secretly filed away in some cabinet at the foundation. And so just really wanted to say thank you for actually taking this research and trying to make sure it's disseminated so it can be used by our community. So thumbs up for that. Thank you.
Oh, you are most welcome. And part of my role in coming to the foundation, the question asked was, how do we make health salient again? Certainly not something I'm going to do alone, but part of it felt like getting the community on the same page, or at least with the same resources, to be able to think about advocating in a more consistent way is probably a great first step. So, the question I'm asking is, how can we do more of this and make it more readily available so that we're using what we've got to make stronger logical or stronger emotional arguments?
Mandy?
Sorry, just one final, I guess, thought maybe for future research is, given there is so much concern in donor countries about problems within the donor countries themselves and kind of a reticence to look outward or want to put money elsewhere, are there messages that work that acknowledge the issues that are existing within the donor countries themselves, but also can speak to the need to continue to support the rest of the world?
Yeah, and I think that's embedded in some of the research, and whether it's the fair share argument to say, we know we've got problems at home and we should be doing our fair share, partly because the global health security message tends to at times feel like a racist argument, that what's happening over there could come over to us, but it worked for COVID, right? And so, it's Mpox is another issue, climate change and moving malaria. So those things are still relevant. The thing I've been thinking through is, I don't think the global health community should be trying to out-salient climate conflict or the economy, but should reinforce the sure thing that health delivers and the foundational support that health provides to other areas, and make those connection points. And again, it feels a bit like a new era and a new time. And so I would encourage thoughtful piloting and testing of different approaches, because we are not in that golden era anymore.
Oh, yeah, yeah. I mean, just a comment that we get sometimes on the Hill is, oh, our boss is very supportive of this, but we can't be seen publicly prioritizing
Yes.
these issues because
Right.
these are issues within her home state or his home state. And our constituents are asking for more investment in the state to address poverty,
Yep.
health, all of the things. And so always trying to look for ways that can connect the two issues
Mhm.
as not
So
so separate.
where are innovations being developed? Could be in certain states where scientists developing things could be
Yeah.
producing things. I mean, certainly, I mean, there's a way to do that. And one of the things that we've been thinking through, at least I have, is in our support of Gavi and Global Fund or other kind of institutions, it's a much more surgical approach. It's not, some countries will want to be quiet. They'll want to sign the check and do the thing, but they don't want a big fanfare for it. And so understanding that is super important in putting these at play. So I think it's a much more audience first approach than we've had to take in the past, where it might be an easier blanket approach to things, but now I think it's a lot more specific and a lot more strategic.
Yeah, specific and strategic. That's a good note to end on. Thank you so much, Marshall. It's definitely, it's great work. And when you finish round 2, we'll have you back for sure. But yeah, just thank you, and echoing Marissa's comments about the transparency, it's really appreciated. And this definitely gives us a lot to think about as we're planning for next year. So thanks again. And we'll share a recording of this and also make sure everyone gets the link again to the full site. So that'll be coming your way in the next couple of days. So thanks again, Marshall. Really appreciate it. And thanks everyone for joining and the good questions.
Thank you, everybody.
Take care. Bye.